Hi, I'm Suneet Mittal, Director of the Cardiovascular Service Line at Valley Hospital. I'm joined by Dr. Raj Tyal, Director of the Cardiac Catheterization Laboratory, to talk about renal denervation, an exciting new procedure in patients with drug-refractory hypertension. Raj, welcome.
Thank you.
Well, as cardiologists, we care for many patients with hypertension, and thankfully most can be managed well with medications. It often requires more than one medication to control their blood pressure. But unfortunately, there are many patients whose blood pressure remains suboptimally controlled despite the use of multiple medications. And it's in those types of patients that we have to really think about renal denervation. Raj, maybe you can talk a little bit about what is renal denervation and how did it come about to be?
Of course. So it's not anything that's new or novel. In fact, there were some surgical techniques which mimicked this therapy that were established back in the 1950s. Since there have been a number of different iterations to try to attempt to figure out how to deactivate an overly active central nervous system and the signals it's sending to the kidneys, because that predicates a lot of our blood flow and volume status and overall our blood pressure. So what the procedure is basically going into the renal arteries and then either using an ablative technique, whether that's radiofrequency or ultrasound, to then decrease the afferent and efferent nerves to the kidneys, and as a result, it will decrease the overall mean blood pressure by around 9 to 10 millimeters of mercury, or your systolic blood pressure by around 15 to 18 millimeters of mercury.
Can you summarize a little bit about the clinical science that supports this procedure, and how much more effective is this than just giving someone yet another blood pressure medication?
So that's a good question. When you look at the overall prevalence of hypertension, 1.3 billion people in the world have high blood pressure. And of those, only 1 in 5 is actually well controlled despite being on quote-unquote guideline-directed medical therapy. If you're able to drop somebody's blood pressure by around 10 to 20 millimeters of mercury, you decrease their overall morbidity by 13% as a relative risk reduction. So it is impactful in order to really have good control, particularly at night, is when we see that people often have fluctuations in their blood pressure without really being fully cognizant of it.
Yeah, and it seems to me that there may be a role even as combination therapy, because with medical therapy, we know these days the cost of therapy, compliance rates vary, and here's a procedure that is presumably a one and done type of procedure that is always working for the patient.
What we have seen is that there is no big downside in terms of risks. The benefits are clearly there, and if we actually are very vigilant and thorough in ablating all 4 quadrants, in probably 95% of cases, we have efficacy doing it.
Great. And can you talk a little bit about the procedure? How long does it take, and are there any major complications that can occur from the procedure?
So the procedure, again, is less than an hour. It's pretty straightforward. It's like having a routine cardiac catheterization is pretty much on par with what I would say it equates to. Most patients will go home the next day. Procedurally and risk-wise, there are very minimal risks, most commonly related to access where we go into the groin, maybe a little bleeding or bruising. The risks to the renal arteries, to the kidneys themselves, are negligible. So long-term data to 10 years shows that, if anything, the renal function improves after having this form of therapy, because we're not using a tremendous amount of contrast, there's not a lot of procedural risks, we're not inflating large balloons or doing anything like that could dissect or disrupt the arteries.
Great. And how quickly could a patient expect to see their blood pressure come down after undergoing such a procedure?
So in some instances, you see it happen almost instantaneously, but in most cases, I would say you would expect to see the full effect somewhere 2 to 4 weeks after the procedure.
Great. Now, Raj, you're a big advocate for clinical trials, and you mentioned a couple of clinical trials that led, to the development and approval of this technology. What's on the horizon with respect to clinical trials, and does Valley intend to participate in some of these ongoing clinical trials?
Absolutely. So right now, the primary indication for renal denervation is resistant hypertension, defined as maximum use of 3 different antihypertensive agents with a persistent blood pressure over 140/90. We are going to be a clinical trial site for the AFFIRM Spiral trial, which basically looks at treating all comers. So any patient that has a blood pressure over 140/90 for 7 consecutive days, documented in the office, would be eligible for renal denervation.
Great. Well, I know that there are a lot of patients that I care for that unfortunately are not able to get their blood pressure down below 140/90 despite our best attempts. If a patient were to be hearing our conversation today, what could you tell them about how they could potentially access the services of you and your team for this procedure?
So we've created a formalized interventional hypertension program. There's a central referral line and consult service available in the hospital. We have a formal clinic on Fridays where we sit down as a multidisciplinary group and review their blood pressure medications, make sure that there aren't quote-unquote secondary causes of hypertension, talk about pre-procedural assessments, whether they need a CT scan or any other form of formal testing, and then we'll see them in the office and discuss the risks and benefits of the procedure thereafter.
Great, and I think this team-based care is so important because it's more than about doing a procedure. It's to make sure that the care has been appropriate, that some medication that could work hasn't been overlooked, and really trying to find patients in whom we can ensure are going to have the maximal success from the procedure and the lowest possible risk of complications. Well, Raj, thanks very much. I think we're really excited about the launch of the Renal Denervation program under the guidance of you and your team. And I know a lot of patients with hypertension will stand to benefit. And we look forward to coming back and reviewing the status of this program in some time.
Perfect. Thank you.